Good afternoon, everyone, and welcome to today's PHO Rounds presentation on UCAN, the Youth Concussion Awareness Network. My name is Sarah Richmond, and I'm the Injury Prevention Lead here at Public Health Ontario. I have the pleasure of moderating today's session. I'd like to start with a land acknowledgement. I wish to acknowledge and express my gratitude for the land on which PHO operates. For thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit. Today, this meeting place is still the home of many Indigenous peoples from across Turtle Island. It is now my absolute pleasure to introduce the speaker for today's presentation, Dr. Nick Reed. Dr. Reed is an associate professor in the Department of Occupational Science and Occupational Therapy at the University of Toronto. He directs the Oak Concussion Lab and holds a Canada Research Chair in Pediatric Concussion. His work focuses on developing, delivering, and evaluating research, educational, and clinical programming specific to youth concussion. I'll now hand it over to Nick.
Thank you so much, Sarah. I really appreciate that amazing introduction, and a few more thank yous to start our session today. Thank you to everyone at Public Health Ontario for this great opportunity, and to the amazing PHO Rounds team for all their support in getting things set up today. Very, very appreciative of this opportunity. So thank you. And of course, thank you to everyone for being here today, carving out time in your busy lives, especially in this busy month of September. I know everyone has lots on their plate, and you're all here today with us. So that is greatly appreciated. And I hope that your time is well spent and you enjoy today's session. So as Sarah mentioned, I will be sharing today on one of our projects, and I'll be a little biased here. It's probably my favorite project of our Oak Concussion Lab at the University of Toronto, our UCAN project, or the Youth Concussion Awareness Network. And I'll just mention that I think this is my favorite project because it allows us to enable youth to help each other and really shine some light on the amazing impact that youth can have in the lives of each other, in this case, in the context of concussion education. So my goal today is to spark some interest with all of you around this program and hopefully spark some collaborations as well. So if anything excites you, there will be some contact information at the end of the presentation, and please reach out at any time to discuss further. So let's dive into today's presentation. First off, a disclaimer, so I'll just put that on the slide here briefly, and then I'll move to my disclosure. So no relevant financial relationships. Do want to acknowledge my funding, as well as holding a Canada Research Chair in Pediatric Concussion, and I do act in a unpaid role as the chair of the International Pediatric Brain Injury Society. Okay, so what are our objectives today in our time together? First and foremost, I want to attempt to describe our novel, I think it's quite novel, approach to concussion education that we've used to date in Canadian high schools. My hope here is to promote some uptake of this program in new contexts and communities. So if this is something that's new to you, you haven't heard about this program, but you're thinking, wow, this would be really fantastic for my community, for the schools I serve, for the sports teams I serve in my community, then, let's talk more. I think it would be fantastic to see how we could make that happen. And then hopefully you can utilize some of the concepts shared today to develop and implement novel approaches to concussion education. And I can be a helper in that. So if nothing else today, at least you have a new friend in this space. And if you're looking to improve your concussion education programming and perhaps engage some youth in the process, I'm really happy to help you do that and chat together. So let's see how we do with these objectives today in our limited time together. But hopefully we can touch on a few things that really spark your interest today. Okay, so I won't spend much time around background. I think many of you are well versed in the area of concussion and the impact that it has on youth in all of our communities across this country and the world for that matter. But as we do know from some of the literature, concussion incidence is increasing amongst youth every year, and we see these really nice trends of increased injury and getting the care that kids need post-injury. We also know that despite these increases in concussion incidence, we do know that concussions are underreported, particularly in the youth population. And the literature has told us there's a few reasons for that: lack of knowledge, perhaps the environment that youth are interacting in, and some of the fears of sharing that injury and some of the implications of doing that. And so we need to be aware of that. These injuries are happening, and not everyone is letting people know that they feel ill and that they need the support that we could provide for them. We also know that social participation after concussion is definitely impacted, and it's impacted oftentimes by peers not understanding what a concussion is or what their friend or their teammate is really going through when they have a concussion. Hence, some needs to focus on those peer-to-peer and social aspects of the recovery process, particularly amongst young people. Research has shown us as well, not just in concussion, but in many other fields and areas of study, that peers are strongly influenced by their social networks, and that peer education can play a very significant role in knowledge, attitudes, and both intended and actual behaviors related to health. So all this to say, we thought there was a need to fill around, can we think about concussion education a little bit differently? Can we bring all of these aspects together and see if we can tackle this gap in the system and this issue a little bit differently and put youth at the front of it and really allow youth to support each other? So this is where the Youth Concussion Awareness Network was born. And I just want to acknowledge, you see a whole lot of logos on here, acknowledging all the funding sources and individuals and organizations that have been a part of this program. Over the years, we're so thrilled and so grateful. Just really acknowledging Pam Fiselli at Parachute, who has been my co-lead from day one around this project, and so grateful for that support. You may see in the chat, or if not, you can jot down this website. If you want to just explore while we're talking today or at a later time, check out our public-facing website for UCAN, and you can look at some of the other details and see, get a little excited, hopefully, around the program. So throughout the presentation today, I will flash a few of these screenshots, and these are just some of the papers that we've written over the years around UCAN. We won't go into too much detail around these papers, but I wanted you to be aware of them so that, again, on your own time, all that spare time you have on your hands, you can check out some of this information if it does catch your interest. The first one of these papers that I will just mention is our initial protocol paper. So this is where it all began, where we put all the details around our initial research study around the UCAN program. And aside from all the research details in this protocol paper, we also speak to some of the key aspects of the program, some of the aspects of the program that I'll talk about today that really make UCAN unique. So again, just putting these papers on your radar, open access, you can check it out and read it as you wish. But I just wanted to make sure you are fully aware of some of the literature that we produced over the years around this great program. Okay, so let's talk about the objectives of UCAN. So let me give you a bit of a sense of what we're trying to accomplish with this program. So first and foremost, it's about youth helping youth. So we want young people across Canada to know when they're experiencing concussion symptoms. So if they have a potential concussion or a suspected concussion, we want them to know that. We want them to then, their next behavior, to action that and ask for support from others when they have a concussion. So this is going to a teacher, a parent, a coach, someone that can take some action for them and get them the help that they need, and seek the medical care that they require post-concussion. And then the third is we want young people to be amazing classmates and amazing friends and amazing teammates to their peers who have had a concussion. I know in concussion research, and I've done some of this research over the years, we spend a lot of time around interventions and creative ways of treating concussion. And part of me has always thought, all of these interventions are important, but maybe sort of a catch-all is not focusing on the individual that has the concussion per se, but those involved in their lives. And if we can make them better friends, better teammates, better classmates, and give them the tools and supports they need to help their friend, their teammate, their classmate with a concussion, perhaps that's the secret sauce to improving recovery. So that's what we're trying to accomplish with this UCAN program, and really focusing on that peer aspect of things and the social support that we think kids with concussion can really benefit from after their injury. The UCAN program is really grounded in a model that we believe strongly in called the IPARD model. And this is really based in this aspect of service learning. So really taking action, getting young people to do things to then learn from that action that they're taking. And you can see on this slide that the various letters within IPARD all represent a different approach that we use within our program. The I being to investigate. So really this idea of concussion awareness and creating what you'll hear more about, councils to address this change. We then help young people plan and prepare a concussion awareness campaign that can then be shared broadly with their school or sport community. We then really encourage these young people to act, to really put their knowledge together and lead a week-long concussion awareness campaign. We encourage some reflection on those experiences as a member of this council. What did you learn? How did you learn it? What did you like? What did you not like? And the last part of this is a really fun part, I think, where we demonstrate and most importantly, celebrate the impact and the work of these young people. So in our instance, we have our annual Rowan Stringer Concussion Awareness Showcase that brings together all the young people across the country that have engaged in this program, and we get to share all their amazing work, connect them with each other, and really just have a big celebration. To date, we've been doing that virtually, but one day I have a vision of sort of a big national science fair kind of feel where we bring all kids into different locations from across Canada, all into one central place, and we have a real huge in-person celebration. So one day we'll get there, and to date, our virtual approach has been really fun too. Okay, so the intervention itself, as I mentioned in that IPARD model, has a few aspects. One is to create a council. So what we do here is we're really tapping into the club culture within high schools across Canada. And what we want is a concussion club or council to be formed, where we have some youth leaders within that council who are going to be the ones that are taking up the torch and the task of educating themselves on concussion to then educate others. That council then has opportunities to learn about concussion via some curated resources that we share with them. And we give them the tools and supports needed to create a week-long concussion awareness campaign within their school that they're in charge of, that they really dream up and that they get to have lots of fun sharing within their school community and beyond. And as I mentioned, we then bring everyone together at the end of the year and we showcase all the great work and connect the various students from across Canada together to really make sure they feel a part of something big, which they are. They're doing something really incredible, and we want them to know that. We typically run this program across a school year, but we have had different versions of the program across semesters within the school. So sort of that September to December semester or January through June, but we can do full year or half year. Essentially, the early months of the school year are around forming the group, creating that council, finding some student leaders within the school. We then spend the middle months of the year of the program on learning about concussion, giving these youth the tools and resources to develop a concussion awareness campaign, and then actually implement that within their school environment. And then the final months of the year or the program are spent, again, planning the showcase materials and celebrating these amazing young people as best as we possibly can. So when it comes to the intervention itself, the main facilitator of this, and this was by design, we didn't want this to be resource heavy. We didn't want schools to have to work too hard. We didn't have enough people power on our research team to be supporting day in and day out. So we figured, how can we make this really user-friendly, really easy to implement within your school environment? And we landed on a portal, so a web-based portal, very accessible, very easy to find, especially for our youth, something that they can find easily and navigate and engage with without having to rely on other people's availability or anything else for that matter. So the portal itself has 4 main components that really make this program work. First, it has instructions about the program and how to participate in it. So it's sort of that one-stop shop, open up the box, know exactly how to put this all together and work through the different components of the program. We also have a section on the portal for data storage and communication. So this is an opportunity for youth to store their work, share their work, and communicate with us, the research team, as needed. We also, over the years, via requests and working through our research processes with teachers and school staff that are supporting this program, found the need for further supports for teachers to be the most effective facilitators for this type of group. So rather than sort of take it all on as a teacher might in some traditional pursuits within the school, we really want these teachers to be sort of there, but off to the side, a little bit adjacent, right? Supporting the youth to do their thing and to really take ownership, but cheering them on and giving them that framework that they need to make it all happen. So we created some resources for that, and they're housed on the portal as well. And then we also have all of the curated concussion resources that the youth might need to, one, learn about concussion, and then two, create their campaigns to share that knowledge with their peers in the most relevant way that they think they can. So those are the areas. Just giving you some screenshots of what some of our materials look like within the portal itself. So you can see here, it's sort of about the project, all of what UCAN is, how can you make a difference with the program, and really walking our youth in what we think is a really accessible way through what this program could be and should be for them. And just to let you know, all of these materials that you're seeing today were co-created with youth every step along the way. So we didn't want to be the ones to just decide what this should look like and how it should feel. We intentionally have engaged youth in research processes throughout to really learn from them on what this should look like and how it would be most effective to share. So that's been an amazing experience for us, and I hope for the youth as well. We also share some potential schedules or timeframes with the youth so they can start to plan out their programs and their year and what it's going to look like, what to do in September, October, November, December, all the months of the program, and just give them a general guideline on what that could look like. We also encourage that things can change and there's lots of flexibility depending on the demands that these youth are under. And everything else that they have going on in their school and sport and social and home lives. They're busy guys, they're busy girls, and we need to make sure that they feel supported and can do this in a way that works for them. I mentioned this idea of data storage and methods for communication. So all council members have access to an area on the portal where they can save information, they can send messages to us, we can communicate, we can support in whatever way is needed. They can save files and different materials, so everything can all be stored here and they don't have to have different systems to manage their information and their progress within the program. So we try to keep it really simple for them, all one-stop shop, and log onto the portal as a council and everything's there at their fingertips to continue from where they left off the last time they met as a council. I mentioned this idea of support for teachers. So again, some really intentional materials for teachers to understand how they fit best within the program itself. And also co-created along the way with teachers, amazing teachers that have been a part of this program over the years, and we're so grateful for their contributions. One of the key aspects of the portal, and I think the area that takes up both probably the most space on the portal, but also the most time when we look at some of our web analytics, where are the youth actually spending their time on the portal? It's on our resources and tools page. So this is where we have curated some incredible concussion education resources from around the world. So these aren't just the resources and tools that we as a team have created, but all the latest and greatest tools and resources that exist out there. So we wanted to make sure that youth had a choice in this. We weren't telling them what to use and what to engage with and what to share with their peers, but rather we wanted them to see what was out there and for them to explore, learn while they explore, and then decide what works best for them and what they think would be best to share with their peers. So this page, we tried to make it quite functional. So we have some filters that our youth can engage with on the portal itself, so they can start to look at different types of concussion education videos versus infographics versus PDFs, and they can start to align what they're looking at and consuming with their interests. We also tried to mimic some social media aspects of this and social platforms where we have some ability to heart your favorites, so that youth could sort of spend 1 or 2 council meetings reviewing these resources. They could heart their favorites, and those favorites would be stored in a separate section, so they could easily go to those favorites and access them without too much additional burden or work on their part. The key with these resources, though, is that we needed to make sure that they were accurate. So based on latest and greatest evidence and international concussion education and management consensus. And I think most importantly, we as a team really wanted to make sure that all of these resources that were available to youth within our program were actually written for youth. So the language in those resources and tools were facing youth. Youth could see themselves within these materials. It wasn't talking about a doctor or a teacher or a mom or dad. They could really see themselves and apply the information that they were consuming to their own lives and to the lives of their friends that need their help. So let me tell you a little bit about how we did that, because as you can imagine, with all the concussion information out there, it's a bit daunting for any of us, and especially for these young people to sort of sift through everything and decide what's useful and what isn't. So we wanted to do that all for the youth and make it really easy for them. So what we did, and again, flashing up some of these articles that you can take a look at when you have those free moments in your lives, and saying that with a bit of a wink because I know it's really hard to do. But what we wanted to do is really apply a systematic search strategy to this process. So something similar to what we would do for some of the research papers, the systematic reviews that we would publish, and then take those findings and apply it to this very public-facing medium, be it our portal for our UCAN students. So some amazing people involved in this paper. Former students and staff from over the years, you're all amazing, and I'm so grateful for all of you. So what we did with this paper here is we attempted to identify online concussion resources that are suitable for Canadian youth and accurate according to the consensus statement on concussion in sport. And for those who are unfamiliar with that consensus statement, it's something that's created. The original plan was every 4 years or so, where concussion experts from around the world convene and create a consensus on what concussion is, what types of education needs to be shared around concussion, and how to best manage the injury. So we wanted to make sure we were aligning with that international consensus and ensure that any resources also were in alignment with the latest consensus statements. So our systematic process was quite involved. It involved first searching public websites, so hospital websites, government websites, what resources and tools exist out there. Also consulting our friends, so pediatric concussion experts from around the world, to identify amazing concussion education resources that they were aware of. We then applied our inclusion and exclusion criteria to this data set that we were creating. And again, this inclusion was really around accurate, evidence-based, aligning with most recent consensus, and language-facing youth, so intended for the youth audience. And then we reviewed all of that content for accuracy, and as well evaluated the content for readability, usability, and suitability. So we didn't want anything in this portal that was very hard to read, that wasn't considered suitable for this population. It all had to fit. The one real takeaway from this process was we identified a whole lot of concussion education resources, and only a few, so 32 of the 456, actually met the criteria, be it they were based on latest evidence and consensus, and that they were facing youth. So not a whole lot of options out there. We were pretty exhaustive on looking at these resources. So that's something for us all to be aware of, right? There's a lot of noise out there. There's a lot of information, but it's not necessarily accurate, and it's not necessarily targeting the audience we want it to target. So we did this with youth, looking at youth-facing materials, but we could apply the same concept to teachers or to healthcare professionals or to coaches. and sort of this niche language facing those specific target audiences, I think we would find a similar outcome here, where there would be limited resources specifically for specific audiences, which can be a challenge if we really want to implement this education and encourage uptake. So back to our resources and tools page on the portal. Again, just really confirming the need to have accurate resources on here, as well as resources that are facing youth that they can see themselves in and have this information really resonate with them. So all that to say, we worked really hard to curate this list of resources. And we really think, and from our research to date and all of our discussions with our amazing youth who have been a part of the program over the years, we think we did a pretty good job. We think we've given them some amazing tools to explore, and really looking at various mediums as well. So not just written content, but videos and infographics and other things that young people want to engage with. Okay, so those are the resources. That's how the young people get their opportunity to learn about concussion. And then we start pushing them to think about, okay, now you've consumed this information. What are you going to do with it? How are you going to package this information so that you can then share it on a broad scale with your full school community or even beyond? So we've had some schools share their campaigns beyond their school, further into their communities, which is absolutely fantastic. So we encourage our young people within the program to work together to really identify what they think would be most useful for their school community, and just cheer them on along the way. So the students, as I said, use the content from the resources on the portal, but they can also create their own. We just need to make sure that what they're creating is appropriate. So we have had many schools and councils over the years create some of their own educational materials around concussion. All we do in those situations is we ask those youth to share those materials with us, just so we can make sure that they're in alignment. And we aren't sharing messages that are inappropriate with our peer groups. This is where the magic really happens, though. This is where we as a team get really excited, because the students are absolutely incredible with their ability to create super creative, super relevant, and resources and tools that would really work for their school. They know their peers best. They know what would resonate. And it's shocking for me, after doing this for so many years, to think that I would ever make that assumption anymore. And I used to, I'll be honest. I used to go into schools and share these tools and think, yeah, this is going to work. People are going to love this and consume it and learn. But I was wrong, right? I was not one of them, and I made some assumptions that I shouldn't have. And what's really great about this program is the youth are deciding what's going to work best, and they typically really nail it every time. So again, this is where the fun happens. We don't dictate what that campaign needs to look like. We really encourage our council members, our students, our youth to come up with some amazing ideas to share concussion education within their own contexts. And we've seen a range of different platforms and mediums used by these youth. So we've seen social media platforms and campaigns. We've seen quotes and facts on TV screens around schools. We've seen posters and printouts and infographics and presentations, lots of plays and visual art, button campaigns. The sky's the limit. So it's really quite fun to see what young people come up with. And it's even more fun. I mentioned that showcase at the end of the year where we bring everyone together. It's really quite fun to see them learning from each other and thinking, wow, that's a really good idea. That would have been fun to do. So again, this is where the magic happens. All the campaigns look differently every year, and that's really fun for us. And that's the whole point of what we're trying to accomplish with UCAN. Okay, the showcase. So this is where, again, we celebrate our incredible youth. And to date, we've been doing this online, really to facilitate accessibility. Depending on where people are in the country, they can all come to one place online, meet each other, learn from each other, share each other's work, and it's really quite exciting to facilitate. Just mentioning that, again, this event is named in honor and remembrance of Rowan Stringer. I'm sure many of you are aware of Rowan Stringer's legacy and Rowan's Law, but I just want to yet again thank Gord and Kathleen Stringer for everything they've done for so many children and youth across this province, across the country, across the world, to ensure that everyone has the education and supports they need to participate in sport safely. And also to Gord and Kathleen for giving us the opportunity to name our showcase in honor and remembrance of Rowan. Gord's been an amazing partner in this project from day one, and we're so grateful for that. So again, schools share and celebrate their awareness campaigns with each other. We do some fun things. We have some awards as part of this showcase. We have some banners that we provide to the schools that they can hang up in their gyms or in their trophy cases like they would for sport competitions that they win that year. So we have some medals thanks to York Region Public Health and their amazing creativity. So it's just a whole lot of fun. And then the whole mission with this showcase is to celebrate these young people as much as we possibly can. Celebrate their efforts, celebrate their creativity, and encourage them to continue to be the amazing, smart, engaging young people that they are. So it's been a lot of fun. We put some parameters on this. Obviously, we have lots of people trying to share their work. So we try to make it really easy for the schools and the councils with some templates and some time caps on sharing that information. And we've found over the years that putting some parameters on things and giving our councils some guidance on what that end of year showcase presentation to their peers might look like has been really quite helpful for them and caused a little bit less burden if they have a bit of a template to go off of. Okay, one thing I want to touch base on, and this is a bit of a soapbox that I want to step on today for all of you, and I'm sure this resonates with all of you, and you're likely just knowing the roles that many of you play in your communities. You're doing a lot of this already. But again, we really wanted to focus UCAN on this idea of social support and building those social support skills of youth in high schools across Canada. And so to do that, we started with some research to really explore this concept of social support and just again, acknowledging these amazing co-authors and the people who really made this work happen. Thank you all so much for this work. So for this first paper I want to share, what we wanted to do is really tap into the lived experience of youth, in this case, high school females, who have had concussion and what their social support experience was. Did they get social support? Did they want more of it? What were the barriers and facilitators to that? And if it could have been perfect, what would the perfect social support have looked like for them? So I won't go into too much detail in the interest of time today, but we did find some really interesting things that we were able to apply to some of the education we now share within the UCAN program. So one of those things was that youth who have had concussion had different types of social support needs from different types of people. So close friends was a big one. Obviously, we're talking to high school youth. Their friend groups are often an extremely important part of their lives. And what their friend groups could help with, this is what we heard from the youth, was this idea of social inclusion and, being a part of this with them. So being alongside them along the way during their recovery would have been quite helpful. We also heard that youth with concussion would have appreciated support from peers with previous concussion experience. So it didn't have to be a friend per se, but someone who's lived their life, someone who's lived that experience, sharing and validating stories, sharing some empathy, and just being, someone that they can talk to and bounce ideas off of. And then the last group was around parents or guardians. And really this idea of flexing their adult power, especially in the school environment, to advocate for accommodations and help these amazing young people get what they need within the school environment. So from all of that, we realized quickly that this is an issue. This is something that young people need more support with. However, there wasn't a whole lot of education out there. So based on our research, we did create some infographics that are now shared within our program with all of our council members and then beyond by way of their awareness campaigns. And this infographic really tries to help them understand what social support is, how can you be a better friend, a better teammate, a better classmate, and what the different types of social support are: emotional, tangible, informational, and some strategies to try to meet the needs of their peers in each of those areas. I will say these resources have been very, very well received by youth. So if this is something that excites you or could be useful within your toolbox in your own community, just let us know. We have these at the ready and very happy to share them. Okay, so let's talk a little bit about, I'm not going to go into too much of our research data and bore you with some of those details, but I do have some qualitative data to share with you from some of our interviews that we've conducted over the years, and really around just people's experiences with UCAN and if they've enjoyed the program during their participation. So first we'll hear from a couple of council members at some of our schools, and one speaking to the fact that their favorite part was the freedom of choice. And this is something that really resonated with our research team because this is why we wanted to do this program. We didn't want to be the ones saying, this is exactly what you need to learn and this is exactly what you need to share with your peers. We wanted to give them some agency in all of this, give them some choice, provide them with the platform to explore and to learn and to grow and to develop, and just let them run with it and cheer them on as it went. So it was super validating for us to hear this from this individual. And also this idea that it is fun, right? It's meant to be fun. We don't want this to be scary or intimidating. We want it to be something that people really enjoy the learning, but also enjoy the service learning aspect of it, the action, sharing that learning with others. So it was really nice to see some of these comments. Also this idea that it's meeting some knowledge needs. So we heard from another individual within our studies that they learned a lot about concussion and they're glad that they had that knowledge. And I think sometimes we have spent a lot of effort educating around concussion, particularly the last 5 or 10 years. But I think we need to realize that that knowledge isn't always being consumed and digested in the way that we think it might. So we are making some assumptions that we're giving young people this information in some of our traditional ways, right? So people like me doing a lecture or these PDF handouts or whatnot, but maybe that's not the way they need to learn. And we need to think about various options for different learning styles. And I think this quote helps validate that a little bit, that this person was learning new things about concussion, which we think is really important. We also heard from some school staff along the way around it being a good experience, and this idea that they were overwhelmed with the number of students and staff interested in joining the initiative. So, sometimes you would think in high schools that club culture is a little bit saturated. There's so many options. Why would people want to do one more thing? And what we found with the schools that we've worked with over the years is there's a lot of interest in this club, in this council, and not just from the athletes. So there were some assumptions early on in this program that it would be very sport focused, but our intentions is that shouldn't be the case. It should be open to anyone. Concussion can happen to anyone, and everyone needs to know about this injury. And we saw that play out. So it wasn't just athletes joining these councils. It was individuals interested in a future in medicine or perhaps public health, or just people who had a concussion or someone in their lives had a concussion and they wanted to be of service to others and learn more and be very helpful to their peers. So really nice to see. This idea that in the second quote here, that what stood out for one of our teachers was the support from peers. So this idea that it's not just friends helping friends, but these young people were really determined to help a broader range of individuals within their school environment. And I think that was quite heartwarming to see from this teacher and from all of us, that kids want to help kids, and we just need to give them a platform to do so. And also this idea of bringing together kids from different backgrounds, different areas of the school. Really nice to sort of connect some of those dots and introduce youth to people they may not interact with regularly. So that was a really nice win with the program. Okay, as far as next steps, we continue to generate more data and information through our research studies and also our pilots within the communities. So we're incorporating all that feedback every step of the way and trying to make this program as great as it can be and align it with the needs and wants of youth from all across the country and various communities. Also continue to publish our findings in academic journals and try to inspire others to do similar things within their world. We're always seeking funding and sponsors to keep this alive and continue the future of UCAN and make sure that as many schools as possible can engage in this program. So always looking for anyone interested in putting heads together to figure out feasibility and continuity of this work. We are now in the process of engaging with school boards across Canada to get schools involved for this academic year. September's a busy time, so we're very cognizant of that and always open to anyone who wants to get this started at any point in the year. Also, I'll just mention quickly that we are attempting to bring UCAN to the sports world. So we've gotten a lot of feedback over the years and of late in particular, where sports teams in the community would say, you know what, this would work really well with my sports club. Where perhaps the U15 team are the leaders and they generate the campaigns and then they educate the U12s, 11s, 10s, 9s, all the way down. So we sort of have that near peer component that we miss out a little bit within the high school environment. So just giving my amazing PhD student, Brenna Kerr, a whole bunch of credit. This is her PhD work, working really hard to, with youth every step along the way, adapt our school-based UCAN for the sport community. So we're really excited to start to launch that. And if any of you have some interest in exploring, perhaps launching that within your community, you know, some sports clubs that could be a good fit, we are all ears and excited for any collaborations. Also, some really exciting news, just acknowledging my amazing colleague, Dr. Carolyn Emery at the University of Calgary. We've brought together UCAN with her amazing SHRED Surveillance in High School and Community Sport to Reduce Concussions program. So bringing two programs together, and we just recently received some funding from the Canadian Institutes of Health Research to continue to do two things. One, figure out ways to prevent concussion, detect and diagnose the injury, and then also educate as best we possibly can, and using UCAN as that youth-driven model to share concussion education across the country. So really excited to be diving in with Carolyn and so many other amazing folks from around the country to keep this going and generate more and more evidence to support its use. So leaving you all here with a call to action. So when we create concussion education for youth, let's always think about empowering youth to be leaders now, not just in the future. I think oftentimes we give people the tools and resources to learn, and then we're like, they're going to be so amazing when they're in university or after and professionals. But what we've learned is youth are amazing right now. So let's give them the tools and resources that they need in order to be amazing. Let's co-create with youth every step along the way. We need to ensure we meet their unique needs, and we can't make assumptions that what we think is best or what we used to do in the past is going to work for them. So co-create every step along the way. And let's please celebrate youth as much as we possibly can. They are incredible. Every youth that's been a part of UCAN has been absolutely amazing. And I think we need to tell them that as often as we can. If you're interested in learning more about UCAN, you can use this QR code. It will take you to a fillable form where we can get your info and we can keep you up to date on what's going on in the UCAN world. So please do that. Just a few other resources that I thought I would leave you with very quickly that you might find useful. This is our PEDS Concussion Living Guideline that I co-lead with my amazing colleague, Dr. Roger Zemek, out in Ottawa at PHO, as well as Jenny Dawson. Some incredible work here, and you'll find some amazing resources that could support your community. And then also acknowledging our Transcendent Concussion Research Program led by Roger Zemek as well. Some great resources on here, and would love to get you involved in this program if you have interest. I have to make a plug. I know we're running out on time, and I want to make sure we have some time for questions and discussion. But Wednesday, September 24th, it's coming up here in Ontario, is Rowan's Law Day. We heard a little bit about Rowan earlier in the presentation. If you don't know a lot about Rowan and Rowan's story, please do look it up. It's an important legacy that we all need to remember and honor. And again, big thanks to Gord and Kathleen Stringer for everything they've done for so many youth in this province and around the country and the world. Rowan's Law Day, let's celebrate together. Let's remember Rowan. Let's educate as much as we can. And if you need some resources to do that, our friends at OFIA have an amazing toolkit that you can check out. I have to thank our friends in public health, of course, all of you for engaging with me today and being so open and sharing with your time. But some big champions in this space I have to acknowledge. York Region, Silvana, Michelle, couldn't do any of this without you. We're so grateful for all of your support and all the schools that you brought on board. And thank you for being the champions that you are. Porcupine Health as well, Alexandria. It's been such a pleasure working with you and getting this program to some of the rural communities in our province, and as well to the Ontario Concussion Prevention Network. I will close there. Here is some of my contact information. Please reach out if you have any interest. And thank you for all you do in the space of public health and supporting youth across this province to be the best that they can. So thank you all, and we'll open it up to some questions and discussion.
Thank you so much, Nick, for such a wonderful presentation. We will now move on to the Q&A segment to answer some questions from our live audience. Just a really quick reminder to everyone, if you can please enter your questions into the Q&A pod if you have not done so already. So the first question, Nick, is actually around the population in which the program is targeted. So a note that it seems to be targeted at high school students, but just wondering if there is an opportunity for this program to be implemented into elementary schools or junior high schools.
Yes, what a great question. Thank you for that. And the short answer is yes, totally something that can be adapted for younger audiences. We have had some middle schools and junior highs be a part of the process, especially in schools that are more closely linked to their high school population and their high schools. And it's been with great success. So I think certainly we can do that. And also, I think it's just being creative and adapting for the needs and learning styles of a younger population. So we are totally up for that. And one other note I'll make around that is the value of the near peer interactions. So a dream of mine is that we have everywhere from kindergarten all the way up to university and college students engaged in the UCAN program, various years of learning and graduating to the next phases. But how great would it be if our university students supported our high school students, they supported our junior high students and elementary and so on, and we had a really nice near peer connection throughout. I think that would be the dream. So yes, in short, we can do that.
Oh, that's so great. The next question, and it might be a little selfish in my asking of this question, Nick, but what role do you specifically see public health? So those public health units, the public health practitioners that work in injury prevention across Ontario, across Canada, what role do you see them playing in scaling up the program in Ontario or across Canada?
Yeah, thanks, Sarah, for that. And I think from our experiences to date, and I mentioned some of our amazing public health champions, Savannah and the York Region Group, as well as some others around the province, what we've learned is our public health workers are boots on the ground. You are working hard to build the relationships with the schools, with the sport communities, with the parks and recreation departments, where all youth are engaging in activities, could be having concussions, but also providing that opportunity for that direct education. We know you're already in the schools working so hard. And what we've been able to achieve to date with our public health champions is that direct bridge into the school environment and connecting the dots. So if we can put our heads together and be more efficient with those educational initiatives, and we can help each other do that and not reinvent the wheel along the way, that is absolutely amazing. So just commending all of you for the boots on the ground work that you're doing, for getting into the communities, educating across the health spectrum. And if concussion could be part of that portfolio for you, we would love to help you do that.
That's great. Thank you so much. Another question from our chat pod, is the program available in French?
Yes, great question. So yes, we do have French options for our program. So we've translated the program throughout the years of development. And we have had French-speaking schools deliver the program as well. So yes, those options are available, and we're really happy to be able to provide that. And in the future, even exploring more languages to be able to deliver this program in. We know our population is extremely diverse across our province and country, and we want this to be available to as many as possible. But for now, French and English is an option.
That's so great. So another question here about evaluation. So could you possibly share some of the work that has been done in terms of evaluation of the program?
Yeah, so thank you. So we, as a researcher, I tend to think of myself as an educator that does research along the way. And I think it's sort of thinking about this in two ways, down two paths. One, we started with a research arm of this from day one. So it was very much a closed program. We recruited our schools. We had a full research protocol, which you can read in one of those publications that I flashed, our research protocol. And then we spend some time collecting data, and years go by and we're still collecting data, and then eventually we can action that. So that's the one road. And then the other road is let's just get in there and do this and evaluate as we go in a bit of a different way. So we've been trotting along on both paths over the last few years. And when it comes to some of the specific approaches to evaluation, first for our very research heavy path, we created a new survey that we rolled out within the schools. So this survey was based around concussion knowledge, attitudes, and intended practices, and as well injecting some of those items around social support that didn't exist in any surveys and assessment tools that existed to date. So we had to start from scratch. Amazing PhD student Kylie Mallory, who's now in her postdoc and doing amazing things, but she really led the charge on this. And what we did with that survey is we would have the entire school that was participating in UCAN complete the survey at the start of the school year. Then UCAN would happen. And then we would have the entire school again complete that survey at the end of the year to see if we moved the needle around knowledge, attitudes, and intended practices. And also start to explore how those three things interacted, right? Increased knowledge, did that dictate certain attitude? Did that then dictate certain practices? So that was our sort of really data-heavy approach to evaluation. We've also done, amongst other things, we've done some qualitative work all along the way. So really a mixed methods approach here, but some qualitative studies I mentioned around exploring social support, but also all of our councils and schools that are part of the program. We have what we call exit interviews at the end of the program, which are semi-structured interviews, really intentional to be able to evaluate from the boots on the ground. So really sort of at the individual level, what was this experience like for you? What were some of the facilitators and barriers? And how can we use that information to improve the program? And then we also have a whole other arm around data analytics. So we have our portal as our main hub of how this all operates. So we can get a sense of what tools students like the most, what they don't like, how often are they spending time on the portal, what parts of the portal, and how does that inform us improving this experience for them along the way. So in short, lots of evaluation going on, some of it very research driven, some of it more anecdotal to try to improve the program. But then it's our job to try to put all that together and make that experience as good as it can be for the youth involved.
Thanks so much for that. We have another question that's come up with in the chat. And the question is, can some of the content developed by the students be directed to empower students to approach coaches or teachers to let them know about a concerning injury and need for intervention? There can
Yes.
be a power imbalance between students and teachers and coaches.
Yes, how fantastic, right? So in principle, we're trying to empower youth to have the tools and resources to help their peers. But what about sharing that information with those involved in their peers' lives and in their lives as well? So teachers, parents, coaches, whatever that might be. So I think that's happening organically to some extent. Particularly some of the teachers involved in the program have changed their thinking around concussion, and we are seeing some cultural shifts within that school environment around the importance of addressing the injury and the support that's needed after. It's a really good thought, though, to think about some intentional resources built into the program, which we don't currently have, but that could be sort of advocacy driven, right? And sort of really promoting this idea of advocating on behalf of your peers and on your behalf of yourself with those involved in your lives. So I really like that. I think that could be a really nice inclusion as we move along, because we do know it is extremely important. We heard about that adult power, right? That those power dynamics within any institution or structure where youth are involved. We tend to have adults that make some decisions for those youth. So If there's ways for us to influence the culture from the top down, that would be so, so great. So we're going to take that suggestion forward. I think we'll bring it to some of our youth leaders, and I think they would love it.
That's great, Nick. Thanks. Another question here. So what would you say, other than the portal, as you mentioned during the presentation, was the biggest facilitator to the program's uptake?
Yeah, good question. I think, in all honesty, particularly in the school environment, and we go back to this adult power, right? And sort of the top-down mechanisms that we tend to see within these institutions. I think one of the biggest facilitators is having a school administration that really cares about this, right? And I'm sure many of you see this in your work with schools as public health professionals, right? If you have the buy-in from the, that green light from the school, things go a lot easier. And I think there was a few levels of that. First, it was the school administration. So the principals, vice principals, well, even the school board to start, and then it trickled down. But if we had some buy-in there, then generally we could get some teachers to support the program directly. And if we really got them excited about it and we really got them thinking that concussion mattered, then all of a sudden these councils were blowing up and we had all these student leaders that wanted to be a part of it. So I think, it's multi-pronged. I think although we are really targeting youth, it's not going to get to them unless some of these adults allow it to happen, right? So I think I would say without that support from school administrators and teachers, it was almost a non-starter, right? So yeah, definitely a big part of this.
Yeah, their time is quite coveted, isn't it? I mean, all the way
Yeah.
from, as you're saying, sort of administrative level, all the way down to a teacher and student level. It's quite coveted to try, like you're saying, try to sneak more into this
Yes.
already overburdened system is quite a big ask. So the interest would definitely have to be there, wouldn't it?
And yes, and by design and via co-creation too. Again, hence why we wanted to make this as easy as possible to implement within the school environment. That's going to be essential. Otherwise, it's a non-starter.
And has there been, and just follow up to that, has there been any examples that you can provide of where, because when we think about this coveted time and exhausted resources, it's sort of like thinking of integrating the program into something that the students or the teachers have to do anyway. Do you have any examples of where this program has been? I'm thinking, off the top of my head, those volunteer hours that students have to do in high school. Is there any examples you could provide?
Yes, for sure. So certainly we do tap into sort of those leadership roles that are already and programs that are already built within the school environment. And yes, volunteer hours and all of our youth that are part of the program can get letters of support for university applications and so on. So there's some incentive there. I think some examples of where this has worked really well is built into the curriculum itself, if it's possible. And we've seen this in some of our school boards where we have some leadership programs that already exist, whether it's through the phys ed department or other parts of the curriculum. And this becomes a project within that class or within that curriculum component within the school. And yeah, if it's a many need with one deed approach or a 2-for-1, I think it's worked really, really well. So exploring what those could be within the school environments would be really useful for all of us, I think.
Absolutely. I see we're being prompted to transition to the closing. We do have one more quick question
Mhm.
that maybe we can sneak in before the last minute, Nick. Does the portal actually have the opportunity to collect data specific to the number of reported concussions at a school level? As you know, we have a significant lack of data in Ontario, across Canada, specific to sport-related concussion. Is there an opportunity there for the portal to actually collect data on the number of concussions?
Yeah, it's a really good point. It currently does not, but we do have some exit surveys with our school administration where we try to capture that information. I think the challenge, as you're alluding to in our school boards, is that there's no one way to do it. And I think if we could try, maybe it's via UCAN to build in some consistency and continuity on how to do that, that would be really helpful. So the capability is certainly there. It's just building it into the workflow and the reporting within the school environment. And one of our metrics of success of the program could very well be, and I know it's a bit counterintuitive, but an increase in reporting, right? Because we are trying to get people to recognize the injury and feel safe to report it. So that could be a metric of success of the program, and we certainly could build it into our portal system.
Oh, that's so great. Thank you.
Thank you. Thank you
As
all.
we wrap up today's PHO session, I'd like to thank Dr. Nick Reed for presenting. I'd also like to thank everyone for attending today's session. You can expect to receive a brief and anonymous survey for today's session. Please try to complete this to help us improve our programming. Thank you all so much for coming today. And again, thank you so much, Dr. Reed. It was so great to see you. Have a wonderful day, everyone.
Thank you all. Thank you, Sarah, and thanks everyone. Have a great day.